Uh, Hello, everyone. Let's go ahead and get started then. My name is Denise Harlow. I'm CEO of the National Community Action Partnership, and I'm just really excited to have you be part of today's webinar. Uh, we have community action agencies. I think we have some community development commissions, and we have other organizations around today's table who engage in transportation services in community. Local community transportation networks that supplement, that add on to, or are the only game in town, are the hallmark of community-based organizations engaged in transportation. So thank you so much for being with us here today. We have a new partnership with CCAM, the National Coordinating Council on Access and Mobility, and their Training Assistance, Technical Assistance Center, excuse me. And Bill Wagner, the director of CCAM, is with us here today to share with us more information about the Technical Assistance Center, to probe a little bit further on what you as organizations are doing around the field of transportation in community. And I know here at the National Community Action Partnership, we would want to hear more. I've been in the call centers, for instance, of Fresno EOC, of Panhandle Community Services, and have seen upfront how responsive, how busy, how expansive transportation networks provided by Community Action and our colleague community-based organization providers can and are currently doing. So thank you for all the work you do. So I'm going to turn this over to Bill Wagner. Again, he is the director of the Community Action, the National Council on Access Mobility Training Technical Assistance Center. Bill, thank you for being a good partner with us. I know you've engaged with, for instance, Wyoming Community Action up in upstate New York. You've been a good partner to Community Action, and we're so excited about our partnership between our two organizations. And I'm going to turn the ball over to you.
Thank you. Yes, I think it, like you were saying, it's a great fit, a great partnership. I know originally I'm from upstate New York and was running a regional mobility center, and I worked with several community action agencies, some doing Medicaid transport, some doing the public transport. And I know as many of you are in rural areas, and rural public transit is just a very difficult thing to put together and pull off. So prior to the CCAM-TAC, the CCAM Technical Assistance Center, I was the director of the National Center for Mobility Management here in DC. And a lot of the work that we did with the National Center for Mobility Management rolled right into the CCAM Technical Assistance Center work that we're doing now. It was a natural fit. I like to say, you know, we were at the, we had a bachelor's in mobility management before. Now we've upped our game to a PhD level. So with that, I'm going to, recently we had an expo in San Diego, and one of the things I kept hearing a little bit about was what's the difference between CCAM, the Coordinated Council on Access and Mobility, and the CCAM Technical Assistance Center. So I thought I'd start out today a little bit with just a real brief history lesson on what CCAM is. And if I can change my slide. Actually, before I do that, I got a little activity for you. If you can pull out your phone and hit that QR code. And if not, just put in the chat. What I'd like to know is who you are, your agency, specifically maybe the region of your agency, your title. Have you seen or are you receiving our newsletter? And why that would be important is we have funding opportunities, among many other things, that are announced in our newsletter. And if you don't receive it, shoot me your email and we'll make sure that you can get on our list to receive our email. So what is the Coordinated Council on Access and Mobility? 20 years ago, February 2004, President Bush signed an executive order to create what they called the Interagency Coordinating Council on Access and Mobility. If you look at the federal agencies, federal departments, there's well, specifically, there's at least 9 that in some way or another are funding transportation services are with human services needs. Um, the council was made up of 132 federal programs across 9 federal departments. And as you see, as I said, they fund support for human services transportation. At that time, the Secretary of Transportation was designated as the chair of the council. That's sort of how it ended up in FTA's lap to push this forward. And I shouldn't use acronyms. FTA is the Federal Transit Administration, in case you were wondering. In 2022, the CCAM developed and adopted their first strategic plan for 23 to 26. Goals amongst that plan was to strengthen CCAM and improve multi-sector collaboration across all levels, state, local, regional, and federal levels. They also wanted to promote the development of safe and more accessible transportation networks. And the third goal was to address CCAM agency policies. And we'll talk a little bit more about what policies that they are working on to prevent them impeding, the policies impeding transportation coordination. Policies that, they're trying to change to make coordination a little easier. And one of the big things, and luckily for me, and goal 1 was to create a technical assistance center, that would work across multiple sectors and build mobility management and transportation capacity, connecting regional, state, and local CCAM partners to improve transportation access for healthcare, access for employment, accessing food, any need of transportation. We're looking at solving it that would improve, quality of life. July of last year, FTA released the notice of funding opportunity to establish this technical assistance center. Like I said, it was a natural fit for us, having done over 10 years of the National Center for Mobility Management. We just thought we were the perfect choice to take on this new technical assistance center. In January of this year, CTA, the Community Transportation Association of America, signed a cooperative agreement with FTA to operate the Technical Assistance Center for CCAM. As I mentioned, with 10 years of experience operating the National Center for Mobility Management, we thought it was a natural fit. FTA thought it was a good fit. The work that we were doing mirrored the mission of CCAM, and our organization, the Community Transportation Association of America, decided we would rebrand NCMM and expand it into the new Technical Assistance Center. And what I joke around about, in a brilliant display of creativity, we call the new Technical Assistance Center the CCAM Technical Assistance Center. Didn't spend a lot of time thinking about that, I guess. So just a little bit more on CCAM. On this slide, you can see the federal departments that are currently members of CCAM. They sit on a federal advisory board that I meet with quarterly. We've got the Department of Transportation, Department of Agriculture, Department of Education, Department of Labor, Department of Justice, Veterans Affairs, Health and Human Services, Housing and Urban Development, Department of Interior, National Council of Disability, and Social Security Administration. And I'm sure that you have worked with probably more than one of those. As I mentioned, there's 132 federal agencies that are have signed contracts or an MOU committing to support the CCAM network. Um, about 2 or 3 months ago, our executive director, Scott Bogren, was interviewed and was asked about CCAM Technical Assistance Center. And Scott said, and I love this, it's a quote I'm using, and he said coordination is something that in the public transit world has been tossed around for decades. We've talked about coordination. We have what's called, coordinated plans. But the purpose of CCAM technical assistance is to take that coordination from being talked about as a process, and turn it into an outcome. Make it real. Make it have an impact on people's lives more than just people going to a meeting and talking about how we could work together better. So when you look at, we've got federal partners that have committed to advancing this strategy of coordination and mobility, coordination and access. When you take a look at that, it's my job, our job as the Technical Assistance Center is to reach out to people like you, and offer tools, offer facilitated meetings, offer examples of best practices or common practices, communities of practice, and try to take that from something that's being talked about to actually something that has real results, real outcomes. So now I have just, and I promise I think this is the last one more activity. And what I'd like is you to just think of one or two things, 3 or 4 things that makes it difficult for coordination. What prevents these coordinating plans from happening? Why has coordination been referred to in more of a process than an outcome? Just give you a couple minutes to do that. And again, if your QR code isn't working or it's easier to type in the chat, feel free to do it that way. So what is the Technical Assistance Center for CCAM going to do? What are we offering to other community action agencies, other mobility management programs, transit providers? What can we do that will provide assistance to make that shift from coordination as a process to having real outcomes? If you go to our website, and it's real difficult to remember, it's CCAM-TAC.org. You'll see when you land on our website some tools immediately. And if you were live on our website, you could scroll down, you could see our latest blogs, you could find copies of previous newsletters and a whole bunch of other informative stuff. But for the moment, I want to talk about the tools that we offer to you. We have Tackle, which is the Transportation Technical Assistance Coordinated Library. FTA has 6 or 7 other technical assistance centers, and they all contribute to this library, and we house this on our website where you can go in. Maybe you're looking for a specific type, a specific need or an idea. You can search in the search bar, and documents from not just our organization, but from 6 or 7 other organizations will come up. The next tool you see is our community transportation provider map. We have had this is our second version 2.0 of the community transportation provider map. And we have on there over 3,200 FTA funded transportation providers. Now that could be transit in a small urban setting, it could be transit in a rural setting, could be tribal areas that are receiving FTA funding to provide transit. It also highlights, and this is something that you won't find on a lot of other maps, volunteer driver programs that are getting FTA funding for support. And then the last one, the last group would be mobility managers. And I tell everyone, if all else fails and you're looking for a transportation provider in your area, you go down and find the closest mobility manager, and they will have the local resources if you can't find them on the map. Do I have every possible FDA funded transportation center on this map yet? No, that's something we're working at. I think we're probably, and it's hard, if you ask FTA, they don't know who they fund. I would say we're approximately 75% of the providers on this map. Shifting over to the next box, you see our cost allocation tool. That will be going live later this year. We are in the testing phase right now. But that's a tool, I'll go into it a little bit more, but it's a tool primarily designed to help you allocate your cost for shared rides with multiple pickup or drop-off points. And that's something CMS has given their approval. And if it works, excuse me, when it works, it will provide supporting documentation for you billing if you're a Medicaid provider. And then we have a help desk that will be coming up later on in the year. Before we go into any more on the tools, one very valuable service, and Denise mentioned it a little earlier, we recently did on-site technical assistance with the Wyoming County Community Actions Agency in upstate New York, up near Buffalo. And we do these, it's a one-day facilitated workshop. You come in, we give you, some coffee, maybe some pastries or something. Start out, we'll break for lunch, and usually go until 3:30. We have done state coordinated roundtables where we've had 10, 12 state agencies come in. And DOT was one of them. But Health and Human Services, Medicaid, Justice, Aging, Independent Living, all of those agencies represented. And for me, the first one I did was in Illinois. And I was amazed that we were in this big state building, and these people came from all the upper floors down into the conference room, and we met, and we had them start by introducing themselves and talk about how transportation impacts their programs. And you'd be surprised how people weren't even aware that these other programs were trying to fund transportation, or were, worth getting funding for transportation, and what they were doing and the barriers that they face. So just opening up that dialogue and then facilitating ways to find common needs and common resources that could pull together and benefit all. They walked out that day with a plan for a coordinated grant that they were going to be getting, and they were going to address multiple needs across most of those agencies represented that day. We do regional coordinating plans. When I was in Wyoming County, we had 40 some people from various human service providers, transportation providers, planning department, and all of that. And we laid the groundwork for them to come up and develop a human services coordinated plan, which they hadn't had one in 15 years. It was a new executive director, and just the thought of developing a coordinated human services transportation plan was scary. It was intimidating. She didn't know where to start. And that's, she's not alone in that. Many people struggle with that. Like I mentioned, county, I guess Wyoming County was a county, not a regional coordinated plan. And then we work with state mobility management planning, whether it's to have a statewide mobility management coordination, or whether it's bringing in, a bunch of regional mobility managers and get them to work together. We also provide support on some. I mentioned policies earlier that CCAM is trying to remove the barriers to. Um, the cost sharing. How can you share a vehicle with another agency and use FTA funding or other funding to do that? What are the requirements? Medicaid transportation and coverage, Medicaid transportation coverage and coordination fact sheet. Again, how can you bill for providing transportation if you've got one Medicaid person and one non-Medicaid person in the car? The CCAM program inventory. This is a worksheet that has all of those 132 agencies that I mentioned earlier. And it shows the programs they support and how you can use funding from them to support programs that you may be running or trying to get off the ground. And along with that, the CCAM Federal Braiding Guide, they have established, CCAM has established, rules and regulations for matching, using federal funds to match federal funds. Some agencies it's allowed, some agencies it's not allowed, some agencies it's allowed with some restrictions. Another valuable tool that we offer, in the past with NCMM, we did planning grants and pilot grants. Our planning grant process is built on the human-centered design. And I always, my favorite line for talking about the planning grants is, you've heard, the movie Field of Dreams, the famous line in that movie, build it and they will come. Well, that works in the movies, but it doesn't necessarily work in planning transportation for your communities. You got to, get into the weeds and talk to people, listen to people, observe behaviors when it comes to transportation and their needs. And that's where we start with our planning grant process. And then from there, we take those findings and develop concepts and then come up with a plan of action. Our planning grants offer the training. We roll up our sleeves, we get right down in with you in your communities. We demonstrate the interviewing process. We're there to help develop the concepts from what you find, and then you take those ideas and what you've heard and listen from everyone, and build a concept that will go on to become the basis for your plan. What's interesting, and I was talking to our evaluator this morning, in fact, about some of our last planning grants. For example, they started out, they thought the need was, we need cross-county lines transportation for health-related needs. And when they got out into their community and started interviewing different groups and stuff, what they found was the bigger need was people were not able to get to employment. The bus lines was not serving the industrial park where all of this expansion was going and all of these jobs were being created, and people from, the city couldn't get there if they didn't have a vehicle. And so they did a 180-degree turn and they came up with a plan to develop a transportation to employment project, and had, some good success with that. So this year, we're not doing planning grants. We will be releasing the RFP. I mentioned the newsletter. Watch the newsletter because it will be announced when the RFP comes out. And our goal is to have the RFP out later this year with a start date of early 2026. Also on our website, you'll find communities of practice. And I often refer to these as recipe cards. Let's say you're looking at designing a transportation program for children and families, or employment and training, or housing. We have all of these topics broken down and listed, and you can see examples of different funding sources that can be used to provide support, different strategies that can be used to provide support, maybe even some examples of some successful programs that you can reach out and talk to them and get some peer support. I'll be the first to tell you I don't know everything about all of this stuff, but I can find out someone who does know more than me and gladly introduce you. The next thing I wanted to talk about that we're offering, as far as tools, you remember we were talking about the process versus the outcome. Well, one of the things that, I found out in my many years of being in this work is transportation speaks a language. That language is how many trips and how many riders and how many miles. But when you're looking at, maybe some healthcare funding or some employment funding, employment and training funding, they don't care how many rides you give. If you're going to the private sector, maybe you want to get a large employer to fund part of a van pool program, they don't care how many trips and miles. They care about how many employees, how many jobs are filled. They care about reducing their turnover rate. They care about employees showing up on time. You need to find those outcomes and that speak to their language, not totally eliminate the rides. And I'm not saying that, but you got to have a common language that meets of both sides of this equation. So we're working with Yellowwood Associates. They have a curriculum called You Get What You Measure, and it's on developing performance measures that measure the true impact in your community. Giving people rides isn't necessarily a huge impact. Giving people rides where they get a job and become employed, now you're talking about a little bit stronger impact in your community. So that's one of the things that's available through us. We offer some training. We've offered, currently there's a webinar on our website that introduces you to You Get What You Measure. We can have Shauna and Melissa from Yellowwood come out and do workshops if there's enough interest in an area. There's a lot of ways we can help you with that. I mentioned earlier the community transportation map, and one of the things we've done this year is we've merged it into Policy Map. If any of you are familiar with Policy Map, they have, I want to say, 5,000 in some different databases. If you look at this map here on the screen, all of those shapes that are marked in purple, that's all service areas of the transportation providers that are on our map. So if you see a purple boundary, and if you were live on this map, you could scroll over that purple line and it would show you how many providers are in that region. You could click on them and get their contact information. Not this version, because this isn't live yet, but the 2.0 version, for Cineus dialysis clinics. I've done a lot of work with them. They have put this map into all of their clinics and told their social workers, if you have someone with a transportation barrier, use this map and you can find the closest transportation resource to them. This map allows you to look at the whole country. You can search and pull up a state map, and you can see this is, I think this is Ohio. And if you look, you'll see all of the transportation providers that are listed in Ohio. Their names are on there. You click on the name and you could get their contact information, website, and that. You'll see some of them are doing multiple counties. Some of them are even sharing counties, so you'll find more than one provider in a county. And then you can also do a selected area, and you can choose, I chose this for a radius. And I just want to tell you, this is a real live situation. I got an email from a gentleman looking for information on getting his car repaired. His car broke down, he couldn't afford to fix it, and he was looking for us to help him with some money for repairing his car. That's not anything that I do. I can't do this. It's, FTA doesn't fund repairing vehicles. But I do know, and I told this gentleman, is there a community action agency in your area? I know some community action agencies that run keys to work or, CAP programs or that. And he didn't know, and he was very tight with, he didn't want to give me his address. So he gave me some counties that he was around. And I did this search. This is a 50-mile radius of, I think it's Williamstown, New Jersey, which I was finally able to get from him. So I not only was able to say, look in these counties for community action agencies, but if you look at this map, here's some transportation providers. Maybe if you speak to a mobility management, there's maybe a travel training program, or they could tell you what they can offer for you to get to work and your child to get to camp this summer and your other transportation needs. So again, this isn't just about pulling out maps and giving numbers to them. This is a real life scenario that probably occurs more frequently than any of us care to admit. I mentioned earlier the tackle, and this is what, if you click on the tackle, this is what it looks like. If you could scroll down, you'll see all of these different documents and resources that are available. Detailed, who wrote them, what organization, what agency, which technical assistance center they came from. One of the things, tackle's been around, excuse me, for a while. We just recently took it over, but we're going to expand it to not only have documents from FTA technical assistance centers, but we'll be looking for to create sections that would represent other technical assistance centers that these other 9 federal programs have and support. The cost allocation tool I mentioned earlier. So here's some of the challenges that everyone is facing by doing, whether it's NEMT or maybe you're transporting veterans or you're looking for a contract with your area agency on the aging or whatever. All of these programs have different ways that they pay for transportation. And we know that it's not efficient to have a veterans bus, an aging bus, a Medicaid bus, a non-Medicaid bus, and all of that. We know it's much more efficient to share these rides whenever possible. And this tool will, you'll enter our website, go in, it will take, let me go back to, it will take data that you provide, formula and the work process that's been built into the program, and then you put it in and you pull the lever and the bells and the whistles and the lights all churn up, and it comes out with this cost allocation trip sheet that will break it down for what each rider is able to be billed for, and also what each rider costs you for that trip. And if you're doing things right, the cost is always less. But I can tell you, in the process of building this and testing it, we've took it out into real organizations that were providing transportation, and they have found out they were losing $10,000 a month that they didn't know they were losing. So not only is it going to simplify the process of billing by giving you the documentation, but it also may show some shortcomings and where you need to be a little more effective. Also, if you are in a state where you're negotiating with a broker for the Medicaid rates, this gives you some leverage If they're offering $1.25 per mile and it's costing you $1.50, I can't imagine many of you want to take that trip. And if the brokers start to sense that they can't do that for $1.50 or $1.25, I mean, you have some negotiating power with that. So, I lied earlier. I do have one more of these, but I want to really open this up to questions right now. Anyone have any questions or comments?
Bill, I haven't seen any questions come in just yet. But friends, you can put it in the Q&A. You can put that in the chat. You might even be able to raise your hand and I could allow you to speak. Bill, could you maybe, while we're waiting for folks to get their questions in, talk maybe a little bit more about the technical assistance and how folks request that and maybe who's a good fit for it?
Absolutely. So the technical assistance, if you go to our website and look under grants, the first thing we list, and it's not really a grant. There's no exchange of money, but you'll see on-site technical assistance, a link. You click that link, and I think it's like 7 or 8 questions. It's really basic. Identify who you are, your region, what you're looking to accomplish. Like I said, Wyoming County, they really needed to figure out what was going on with transportation in their county. They had all of this interest from different providers, human service providers, and they had a transit system in a large urban area that was serving 7 rural counties, and there was no communication. They didn't know. And it was funny. I was actually talking to them as I was driving in. We stayed in Buffalo the night before, and I was driving in. I saw 2 of this transit providers, rural buses, driving down the road less than 10 minutes from where we were hosting the meeting. And over half the people in the room didn't even know they existed. So again, we can facilitate that communication. We can identify resources. We can identify strategies with you to improve coordination, to look for funding, to create projects that will work and serve the needs of your communities. So I've got 5 states right now that are interested in doing this. One of them has already completed the application and we've chosen the date. I've had regional programs that have filled out applications and we've selected dates. I mentioned the county level. It can be community-based, county-based, state-based, whatever the need might be, and we're willing to go and help you meet your needs. We'll talk, we'll have several meetings, Zoom meetings to talk about what you want to accomplish, and then we'll come up and devise a plan. And we try to do a lot of hands-on activities where to get you involved and get you communicating with the other people around that are in the room that maybe you see them on the street, maybe you don't know them. But that's, kind of what we do for building that project. That's free of charge. We buy you breakfast and lunch and give you lots of fun activities to do.
That sounds wonderful, and I want to highlight the it's free of charge part because that's a great service to our community. So a couple of things have come in, Bill,
Okay.
while we've been talking through this. A question from somebody. It's actually something you and I have talked about before. Community action agencies need to develop a community needs assessment. Is CCAM-TAC able to support the development of the transportation section or offer best practices of data survey questions to ensure transportation mobility is thoughtfully included in the assessment? And so I might just preface this by saying, with 995 community action agencies, unlikely that CCAM-TAC can develop, every agency's specific transportation section, but you probably do have some great resources that you could offer around that, getting the data on transportation needs, or ensuring that transportation is thoughtfully included in the assessment.
Absolutely. And we have a ton of resources. You can find a lot by surfing our website, but give me a week to 10 days with something with a request like that, and I will pull together some of the better resources that I can find. That's another maybe you want to plan on doing a needs assessment in kind of coordinating that with a on-site technical assistance. We could come in and do a training on that. There's a lot of different ways. We try to be as flexible as possible so it works for everybody.
And I might add, Bill, to that through our partnership that we have now, right, between NCAP and CCAM-TAC, that friends, if you have transportation needs, if you have resource needs, please send them our way, because we sit on the content partner roundtable that helps to inform the resources that CCAM-TAC is putting out. And so, the better that we're informed, the better that we can make sure that your needs are represented in the resources that are developed by CCAM-TAC. So
Absolutely. A large part of our strategy, we're not recreating the wheel. We're looking for areas that are doing things that are working well. I mentioned, coordination, or Scott mentioned coordination as a process. There's places that coordination is really working and working well, and we try to highlight them. We try to, put them out there and share information on how they're doing it, how it's working, what drove them, how did they get there, what was the process, all of that. So great resources. NCAP and CCAM-TAC are sharing information for the newsletters. And there's a lot of ways, but certainly we're open to highlighting those successful projects.
yes, yes, yes. So there are a couple more questions that are coming in, Bill. Do you communicate more with local level of mobility, or with the local level of mobility managers, or through state agencies, looking at helping to be one stops for showing transit at the local levels, looking at helping to be one of the several stops for showing transit at local levels? Sorry, I think I jumbled that a little bit.
Yeah, that's okay. I think I know what you mean. Before I answer that, I see there isn't a comment that was just made. This webinar will be available on our website as well. So someone asked if the video or slides will be available. The webinar will be posted probably next week. So to answer your question, I wish I could only work at the local level. I think, for me, to see the change happening, to see, the different parts of the country, that the challenges are different, but yet still the same. I love solving those problems. I love working with the individuals. I could tell you, if we had another hour, all of these heartwarming stories that will choke you up about what you learn from people. I was in a large senior center for a meal that they were providing, and just watching the interaction with the people was incredible. And there's so much like that I wish that that's all I had to do. But unfortunately, I can't ignore the federal level. And, if you don't involve the state, it's not going to work. The state becomes the barrier. If they aren't on board with the changing of policies or allowing certain things, the federal government will give you permission, but if the state isn't on board and you're getting your funding, a lot of people get their FTA funding through their state Department of Transportation. And if that state isn't on board with something, that's a barrier. So we work at all levels, and we do a lot. I have a meeting after this with FTA to talk about some policy changes that need to be made to improve the likelihood of coordination and that. So I'm across the board, a little bit. Some days I got my jacket and tie, and I'm into, talking to someone on the Hill or over at FTA, and then other days I get to wear, you know, jeans and a t-shirt because I'm going around in a community talking to people in a homeless shelter or something. So, um, you got to you got to touch all three places or all three levels to make it work.
Bill, that ties nicely to the next question that came in, which is what incentives do state counterparts of CCAM have to participate in the federal programs of CCAM?
Very, very good question. And it's a it's a little challenging to answer that right now. I can tell you, in Illinois, one of the driving factors for Illinois to come together with a state roundtable is because they wanted to have more control. They looked at what was going on at the federal level, said there's a whole lot of uncertainty. We can't depend on the federal, whether it's FTA or any federal agency. We don't even know if they're going to exist next week. So we need to take control. And that's really what drove them together, to pull that, that round table together and have us come in and help them look at ways they can coordinate and become more efficient at the state level. If funds are being cut, you have a choice. You have a choice of doing more with less, becoming more efficient, essentially, or cutting programs. And we know there are not enough programs and enough services. And if you're cutting them, you're only making things worse. So a lot of it is for the states, I think, kind of self-sufficiency. Yes, they're still going to get federal funding, but they want to have more control on how it's being used.
Bill, I think that's all the questions that we've received so far. We did have one other comment where someone said another webinar on this topic would be great. And good news, I think that this is the first of several things that you'll see us doing jointly. If you have feedback or thoughts on what specifically would be most useful, please reach out to us. I did also put, we have a special email just for transportation work at NCAP that we set up, and it's also very creative, transportation@communityactionpartnership.com. And we will receive those emails and reach out to you for more information. I will also highlight that Bill is going to join us at annual convention at the end of August, and we'll be presenting a session there. Also, we'll have a vendor table there. So if you want to talk more one-on-one with Bill about anything CCAM-TAC, he will be live and in person with us at the end of August in Detroit, Michigan. So
absolutely. And thanks for bringing that up. I also will share that the executive director from Wyoming County Community Action Agency, which received our services, is going to be there to kind of present her view on, why this worked for them, how it worked for them, how they came about the process. So, it won't just be me talking about what I do. You can hear it kind of from a peer about, and by then they'll have some more results of what was accomplished from the meeting. So I'm looking forward to that.
it's going to be a great session. Okay, friends. Bill, any final thoughts?
My last slide is just my contact information. Feel free to email me, call me if you have questions. Can't find something on our website or whatever you need. We're here to support you.
And with that, we'll say, community action friends and all of our colleagues who joined us here today, please have a great afternoon. And if you need anything, give us a shout. Otherwise, take care and we'll see y'all soon. Bye, y'all.